Another Two Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and you're with me. You will be with me in conversation with Dr. Ravindra Savadi, a senior dentist, who will answer Mr. Srinivasan's questions on topics related to dentures and tooth removal and all aspects related to prosthesis or teeth replacement. Do visit our website www.thedentaire.com to get more information about your dental health, and do subscribe to our YouTube channel to get more information and updates about the latest news on dentistry. So joining me today is Mr. Srinivasan. Mr. Srinivasan has worked in several departments, including the ICAR, the Geological Survey of India, the Central Ground Water Board, and finally at NABARD, from where he retired. Mr. Srinivasan has always been an active sports person and has participated in many sports activities, including basketball, cricket, and badminton, the passion for which he continues even today. And he has been an active writer and has written several articles in Deccan Herald. Good morning, sir, and welcome to this talk on Tooth Talk with your dentist.
Good morning. Good morning.
So, so you had some questions that you wanted to be clarified, sir, regarding your dentures and how teeth replacement actually works. So I thought it would best if I could invite an expert from this field. So I have with me today Dr. Ravindra Savadi, who is an expert in the field of tooth replacements. He is a prosthodontist. And Dr. Ravindra Savadi has been a professor in prosthodontics and practices exclusively at Savadi Dental Care. He graduated from his BDS from VS Dental College, Bangalore, and his post-graduation from the prestigious Government Dental College. He has over 31 years of experience in clinical practice and has published several papers in national and international journals. He is trained in laser dentistry from the Geneva University. He was formerly the head of the Department of Prosthodontics at the Oxford Dental College, and he has been a paper setter for both UG and PG examinations. He has been a PhD guide as certified by the RGUHS, and he has guided several PG students in the specialty of prosthodontics. So he was the past editor-in-chief of the prestigious Journal of the Indian Prosthodontic Society. And recently, he completed his tenure as the president of the Indian Prosthodontic Society. So he has been a member of the board for the PG studies of the Rajiv Gandhi University of Health Sciences. Good morning, Dr. Savadi, and welcome to Talk with your dentist.
Good morning, Dr. Rekha, and good morning, Srinivasan sir. Good to meet you, and such an accomplished person. Proud to be able to answer your questions. Thank you so much.
Sir, you can ask him your doubts and questions.
Yeah, Dr. Savadi, good morning again. Actually, my questions are very simple and basic in nature. Of course, your valuable suggestions, your very important to me, and as well as layman like me. And I would put one question.
The voice is not clear, sir. Voice is breaking.
Oh, hello, can you hear me? Can you hear me?
It is
Hello?
slightly. Okay, so you can tell me, sir, what your first question was, what your doubt was.
Should the dentures be removed and kept in water before going to bed? If yes, why?
Dentures must be removed before going to bed. There are two parts for this, two answers for this, two parts of the answer. One, it should be removed because the tissues must get rest. So the denture is going to compress the tissue whenever it is there in the mouth. The denture is going to compress the tissue. So because of this compression, there is going to be reduced vascularity, and it can also cause inflammation of the gums also. So For this purpose, the dentures must be removed to provide rest to the tissues, at least for about 6 to 8 hours whenever the person is gone to sleep. And once it is removed in the night, you would want to keep it in a bowl of water, basically because the water temperature should be cool. The room temperature can fluctuate, it can be hot to cold. So the denture can warp, the flanges of the denture can warp or distort, so it might not fit over a period of time. Though it is not mandatory about keeping it in water, but still what is mandatory is removing it from the mouth and giving the oral tissues rest.
So basically, the gums that are there in the mouth, they need rest because the denture is
Correct.
applying the pressure constantly on the gums throughout the day,
Correct.
either during eating or during speech. So the tissues will need rest to come back to its normal state. That is the reason why it has to be kept in water.
Another thing
Tissues
is,
need rest. They will not come back as such to the normal state. We don't know what is normal. In the sense, normal can vary. It will just come back to. It will just get rest. So the blood supply is more freer, and there is more movement. And because blood supply is free, there is more nutrition. So the tissue is going to get rest. Keeping it in water is basically to avoid distortion of the denture base. But sometimes if it is not possible to get a proper bowl, it can be left outside. That is not mandatory. What is mandatory also is cleaning it in the morning. The denture should be nice and clean in the morning.
hello.
Yes, sir. Next question. Next question.
How often? How often you need to?
What intervals the denture should be replaced?
So at what intervals? How often should we replace our dentures? So I think that's a very pretty common question patients ask us.
Absolutely. Now, the denture is a inorganic matter. It doesn't change. You make the denture and you just fabricate it. It is going to remain the same even after 10 years. The inside surface of the denture is not going to change, but the tissue is going to change. What I was 5 years ago, I am not the same now also. So similarly, the gum condition inside the mouth is going to change. So because of these changes, now the denture might be fitting in one particular way, and over a period of time, the tissue is going to change. So denture will not adapt itself to the new tissue. It is going to remain the same. So there is going to be movement. It is not going to be firm. So textbooks suggest changing the dentures once in 2 years. But then we suggest changing the denture once in 5 years. Basically, considering the socio-economic status of the country, we recommend changing the denture once in 5 years. So the basic reason for changing the denture is one, the tissues have to adjust, and two, the dentures on the external surface of the teeth are there. They undergo some wear and tear. The freshness of the teeth are not there. The teeth become flat because there is so much of grinding happening. So when this grinding happens, there is going to be wear and tear. So because of this, we recommend changing the denture once in 5 years. Textbooks, all the foreign textbooks say 2 years.
So basically, what happens is the denture is a hard material and it is not an adaptable one. Means it is not flexible. So because our tissues, our gums are keep changing positions, the dentures have to be changed once in 5 years recommendably.
Yes.
Anything else you want to ask?
Yeah, my next question is, which is durable and economic materials to be selected for dentures?
The ideal finish filling also. Good. The ideal material for making a denture, what is predominantly used, is called acrylic. Acrylic is sorry, polymethyl methacrylate. It's a material, and it has got cross linking, and it's a good material, easy to fabricate, and it is also durable. So ideal material is acrylic. And the teeth also are made up of acrylic. They are also cross-linked. Cross-linking means there is polymerization of the material which is happening, and there is cross-linking of the chains. Because of this, more strength is there. So acrylic is the ideal material, and it is in fact the best material. Though Indian acrylics are there, and then I use an acrylic from one company called Ivoclar in Germany. So different companies are there. So Indian materials also are there, suiting the budget.
But which is economical?
Acrylic only, sir. Indian material is an acrylic H. Indian materials, and more importantly about the denture, about the denture, more than the materials, it is the understanding by the dental professional about fabricating a denture. So even this one, so if the dentist surgeon should know how to fabricate a denture. Not everybody has that reasonable quality of experience in fabricating a denture. So material wise, it might not be. The dentist is going to charge depending upon his skills and the materials that he's going to use.
So there has to be a collaboration between the lab technician and the clinician. There has to be a good collaboration between the lab technician and the clinician
Yes,
to fabricate a good denture.
That is the clinical skill of the dentist.
Is there any other material other than acrylic?
So the cost of every denture would vary depending on the clinical skills of the dentist, and also how well the lab person fabricates the denture. Although probably the same material will be used by two different people, so the cost may vary slightly depending on this. Yes, sir. You wanted to ask something?
Yeah, another, of course, this question is, suppose I have 12 teeth, healthy teeth, and among the remaining, some are worn out and some are decayed and giving pain. In such cases, is it advisable to remove all teeth and have full dentures, or get RCT for selected teeth and extract useless ones, that is either shaking or fully decayed, and have fixed and removable dentures for the removed teeth?
Sir, the adage goes like this in dentistry. It is the perpetual preservation of what remains rather than the meticulous replacement of what is lost. So the effort is always towards retaining what is there as far as it is possible. So any dentist worth his efforts should try to make a good effort at trying to retain whatever that is there. But there are certain parameters which we follow. When we feel that it is not possible to retain at all, then we go in for extractions. So always meticulous, perpetual preservation of what remains. I can also make it reverse also. It is the meticulous replacement of what remains rather than the meticulous maintenance of what remains rather than the perpetual replacement of what is missing.
Yes.
Always better to preserve teeth wherever possible.
So wherever possible, it is always best to retain what is natural, because that is what gives the maximum amount of strength and the maximum amount of chewing efficiency. So in any case, however it is happening, it is always best to whatever can be saved, we save. And then depending on the situation of the patient, either he can go for a fixed type of a denture or a removable type of a denture, or an implant type of a denture, depending on what is convenient for the patient.
And even if by chance the tooth are broken because of cavities, you can also, there is a new concept of what is called as a submerged root, wherein the root can be submerged inside. That what the root is going to do is it is going to retain the surrounding bone. The bone will not resolve. So that is going to benefit the patient because bone is not going to resolve. So that is also another technique that is followed nowadays. It's coming only into the near recent past.
So that's a very interesting concept. So probably we can have another day talk on retaining, submerged roots and how to preserve the bone, so that probably even dentures on that have better strength and serve better efficiency for the patients. So probably we could have another talk for that day. Mr. Srinivasan, is there anything else you wanted to ask? Hello?
Actually, last question I asked,
Huh?
the dentures have to be completely, I mean, at regular intervals, we have to change because new tooth will be extracted and then again we have to go for another denture like that.
Huh. So so what he is asking, sir, is that if any teeth are remaining, if do we have to retain it or remove it beforehand? Because at a later date, if they get spoiled and we have to keep getting teeth removed, that means we have to keep getting new dentures done subsequently.
Once again,
Sir, what Mr. Srinivasan is asking is that if there are some teeth remaining and we go ahead and replace the missing teeth, and at a later date, if these teeth have to be removed, then we have to go in for new dentures then.
no recovery.
No.
Poor audio. I couldn't get your question at all.
What Mr. Srinivasan is asking, sir, is that if
Yeah, now it's
no,
clear. Now it's clear. Then.
huh. So what he's asking is that if there are some teeth that are removed and some are remaining, and if I go ahead and get dentures for the lost teeth, and subsequently if I have to remove the remaining teeth, then I have to keep going for new dentures every now and then. How feasible is that, or how does it work?
No, depending upon the quality of the denture, you can add certain amount of teeth the same denture. You don't have to keep replacing the denture for every tooth removed. So depending upon the quality of the denture, if with what material it is fabricated, you can add new teeth.
But that adding
Very good info.
But I think adding new teeth every time will not be possible. To an extent, probably, if it is a more recently
It
made
is up to a
denture.
certain extent.
Uh,
Up to a certain extent, it is not possible all the time. Depending on the quality of the denture and depending on the location of the teeth. So it may not be possible everywhere, but some situations, yes.
But if we add one more tooth to the same denture, then impressions will not change. Impression, that there is no problem.
so we didn't get the question. We're not very clear.
At all.
The voice is breaking.
No, by taking impression, suppose if you add a new teeth to the same denture, hello, can you hear me?
Yes, sir.
Suppose I add one tooth to the same denture, old denture, without changing the denture, then the impression when they take, will it be just, will be all right? Will be all right.
That will not
Impression
make
they
a
take
difference.
every time.
No, it will not be necessary to make impression when you're adding one tooth. It will be done in the mouth itself.
So sometimes what will happen is an addition of a tooth can be done in the mouth itself, but sometimes we may have to send it across to the lab to get the denture fabrication. So at such times, maybe using old dentures again to add new teeth may not be a possibility, isn't it, sir?
Yeah.
Mr.
Okay.
Srinivasan, anything else you wanted to ask?
The
I think
audio quality is
we
very
answered some.
poor.
Yeah,
The audio
I
quality is very poor. Maybe.
Yeah. So what we'll probably do is since there were some topics that were raised here, probably we could have a separate discussions on that topic another time. So I think some basic questions were answered in this session. So probably Dr. Savadi, another time maybe we could have you and then we could clarify on some
Most
other
welcome.
topics. We could not elaborate this time.
Yeah,
Mr.
most
Srinivasan,
anytime.
Mr. Srinivasan, thank you so much for joining us today and asking your questions. And thank you, Dr. Savadi, for joining us and answering Mr. Srinivasan's question. I hope we can have you another time to talk with us on
Most,
another topic.
most
On
welcome.
Thank you, sir. Thank you so
you.
much.
Most
Thank you both. Thank
privileged
you,
to
Dr.
be here,
Savadi.
and thank you for inviting
Thank you, Rekha.
us, and best wishes for you. Thank you, sir.
Thank you.
Thank you.
That was Dr. Ravindra Savadi answering Mr. Srinivasan's questions on some important topics on dentures and how dentures can be replaced. For more information about your teeth, do visit our website www.thedentaire.com and do subscribe to our YouTube channel to get the latest updates on our video posts. And you can contact Dr. Savadi. His credentials are given below in the subscription box. And until next time, I come back with another dentist with another topic about your tooth health. You keep smiling and be happy. Thank you.